Federal Drive is presented by GEHA, Government Employees Health Association, proudly providing health and dental benefits to federal employees and their families. Visit GEHA.com.
Contracted medical exams are the foundation for determining disability benefits. But GAO says oversight gaps put exam quality and veterans' benefits at risk. We'll discuss what needs fixing and why it matters with GAO Director Elizabeth Curda. Ms. Curda, thank you so much for joining me.
Thanks for having me.
The veteran disability claim adjudication process has been in the news quite a bit lately, and GAO recently completed an assessment of the first stage of that process, the disability exam itself. Before we get into what you found in that report, just give us a feel for how the disability exam process works.
Sure. The disability exam process is an important component in the decisions that VA has to make about a veteran's claim for disability. So, for example, if a veteran was injured during their service in Iraq and they have ongoing hearing problems, but they don't have medical records to substantiate that, they might be asked to do a medical disability exam to establish that they have that condition that it's connected to their service.
How much does the VA spend on this, and do they do it all in-house?
It's a very costly program. It used to be done within the VHA hospital systems, Veterans Health Administration, but in recent years, they have shifted most of the work to contractors, and VA spends about $5 billion. That was the expenditure in 2024, and the contractors do over 90% of all the disability exams.
So as GAO got into this report, what motivated you to start it, and what did you find?
Well, we had a request from the chairman of the House VA committee, that's the Subcommittee on Disability and Memorial Affairs, Chairman Luttrell, to look at the quality of these exams. You know, when you have a contractor performing a function for the government, your toolbox in terms of keeping that contractor accountable, you have to be able to show you have oversight over the quality of the work that they're doing, in addition to things like timeliness. And so they wanted to know, what is VA doing to oversee the quality of these exams? And so we took a comprehensive look at all aspects of their oversight, and we found that overall they had a lot of processes in place for oversight in the areas such as preventing errors, detecting errors that occur, and correcting them after the fact. So a lot going on, but we did find some areas for improvement and made recommendations.
I can imagine that the distribution of contracted providers for this service is nationwide, so that oversight is especially critical in helping to ensure that a veteran in Indiana has a similar experience and quality as a veteran in Texas or California. What were the sorts of challenges that you discovered?
Well, we made 5 recommendations that cut across 3 broad areas. And those broad areas were, we found breakdowns in some of their procedures for identifying and correcting the most frequent or complex issues with exams. We found issues with financial incentive payments that they make to the contractors. We found errors, and that resulted in overpayments. And we saw a gap in an important source of feedback, which is the examiners themselves. VA gets feedback from all different parties, the contracting companies, the veterans, but they didn't have any way to get direct feedback from examiners who are doing the day-to-day work.
The part of VA that administers this is the Veterans Benefit Administration, not the Health Administration portion of VA. Is that correct?
Yes.
And so VBA not only manages these exams, but also the full disability determination requirement. They must be stretched pretty thin.
That is correct. We have been reporting for years that they are on our high-risk list for managing their workloads. And that is basically the influx of claims and being able to handle those in a timely basis. So yes, they have been historically stretched pretty thin.
I'm speaking with Elizabeth Curda. She's a director in the Education, Workforce, and Income Security team at GAO. So Elizabeth, then tell us more about the recommendations that you made particularly.
Sure. We made recommendations over 2 years. Our initial report on this was last September in a hearing, and we had a recommendation for a process that VBA conducts in which they feed to the contractors on a quarterly basis the most frequent errors. The contractors are required on a quarterly basis to write a report to VA on what they're going to do to correct those errors. Now, we found that VA did not have complete and effective practices for how to review these reports. So they had, the quality review people would get these reports back from the contractors, and then everyone would write a little summary based on sort of what they thought they should be doing. But there wasn't any procedures for what should they be looking for in these reports. And the two things that we found that were missing were nobody checks to see if the contractors go back and actually do these actions. So there's no checking to see if the contractors are fixing things. And there's no effort to determine if those actions were effective or not. Are they seeing the errors go down? What's the outcome of all this work? So that was one area. Yes.
It sounds like that might be an opportunity to deploy AI. If you're getting all of these reports in, maybe an AI reviewer could help streamline those and tell you about trends and where to follow up.
Well, that is another topic because that is very complex. And VA is really, we have, discussed some of their efforts with AI, and it's really kind of at its very beginnings. So, but yeah, potentially.
And so what was the second recommendation?
Yeah, so the second area also had to do with oversight of exams, and it has to do with what they call special focus reviews. And these are three areas where they're very complex, and they tend to have a high error rate, and it's traumatic brain injury, military sexual trauma, and Gulf War illness. And so they had a procedure to do these every 2 years, and they had done one round of the reviews, but they were late, over a year late, doing another round of reviews. And so we recommended that they basically do the second round of reviews on schedule. We subsequently, in the course of our work, learned that their staff had been cut by about 50%, the folks who were doing this particular function. And so they said, in response to us, that they will be switching to a 3-year cycle, which in our view it's better than no years. But we think the 2-year cycle would be ultimately better because then you identify things that are working or not working and can take corrective action sooner. They also have begun negotiations on their new contracts for these contractors, which are long-term, they were multi-years, and things that they're finding from these special focus reviews could be built into those contracts, but only if they're done in a timely manner.
Did you get any feedback from the providers themselves about how this process was working?
Yeah, we checked in with the people who do the disability exams. We call them the examiners, and we randomly selected examiners to talk to. And what we found is universally is they felt they wanted opportunities to provide feedback about the exam process directly to VBA. Currently, the process is, because they work for a contractor, all that feedback would go through the contractor up to VBA. And VBA basically told us we get all that feedback. The contractor gives us feedback. But what we heard from the examiners is, they don't always feel they're being listened to. They don't always have their problems addressed. And they also sometimes get conflicting information if they work for more than one contractor. Different contractors will tell them to do things differently, and they don't think that both can be right. But they have a hard time resolving these things themselves.
So better communication, more checking. What else was on the list?
Yeah, the last area had to do with these financial incentive payments. The way VBA incentivizes good performance is they have these three areas: quality, timeliness, and customer satisfaction. And they measure for each of the contractors how well they do in those dimensions. And they feed that into a formula that will produce a bonus payment to contractors that score particularly well, and penalties for those that are not meeting basic thresholds. And what we found was the way they calculate these is on a spreadsheet with a lot of manual data entry, and they were doing manual calculations as well. And there wasn't a procedure in place to double check the numbers, the data entry. They were doing some checking, but it wasn't formalized. And so when we reviewed the numbers, we found that VBA had caught some of its errors on its own, but we found some that they hadn't caught. And it was about $2.3 million worth of errors, the bonuses that went out to a contractor that did not earn them. And that really just sends a message that, it's the wrong message. You're getting paid and you didn't actually earn it.
Exactly. How has VBA responded to your findings and recommendations?
VBA agreed, or they use the term agree in principle when they sort of agreed with all the recommendations. They are actually have reported that they're taking action on all of them, and some I think are very close to being implemented, such as the one on financial incentives. They told us there was a hearing on this last week, and they said that they actually have gotten the money back from the contractor, and they are putting in place these new procedures. We just haven't seen that documentation yet, but when we do, we will evaluate whether we can close that one or not. But all of them are sort of in the works, in various stages of completion.
So will you be following up with VBA to check how they're doing?
Oh, certainly. And we always follow up on our recommendations, at least annually, but sometimes more than that, just depending on when they have updates for us.
I've been speaking with Elizabeth Curda. She's a director in the Education, Workforce, and Income Security team at GAO. Thanks so much for joining me today, and thanks for sharing this important report with us.
Thanks so much for having me on the show.
We'll post this interview and a link to this report at federalnewsnetwork.com/Federal Drive. Subscribe to the Federal Drive wherever you get your podcasts.